Have you ever been so concerned after doing your chest workout that you injured yourself because of the amount of soreness that you were feeling? This video is great for you. My name is Dr. Molly, and I'm with Your Goals Physical Therapy. I've had two people come up to me after having a particularly good chest day with some rather acute symptoms that had them very, very worried. So with this first person, they came up and they're like, I don't understand. It's so tender right where the chest muscle hits my sternum, and I don't understand why. I didn't do anything unusual. I did have a really good chest day just a couple days ago, but ever since then, it really, really hurts to touch, and I'm very concerned that I pull the muscle or something worse. Like, can you just tell me if there's a tumor? And I know that that sounds extreme if you're just listening to this video, but if you've been working out and you haven't changed anything, and all of a sudden you wake up and there's an area that is inflamed, that's irritated, that really hurts to touch, your mind goes crazy. Lots of people start to think horrible things. They think they broke something. They think they tore their pec muscle. It's just alarming. And then if you can't figure any of that out, then your brain, especially if you Google something, you always end up with cancer as the answer. So when I saw this person who actually works in the gym that I work out of, I was able to ask, very quickly some questions that calmed him down immediately. So first, was there any swelling? Like, did one side of your chest dramatically swell up? And he was like, no. And I was like, do you see any bruising? Like, is any discoloration? No. And I said, well, then you probably didn't tear anything. It's probably okay. And I said, why don't you come into the room and let's look at this real quick. And so really quickly, you could just tell that he had overtrained his muscles. And that's what it was. It was a very sore, overtrained muscle, and it was a little inflamed. So I told him to go home and ice and stretch. And I showed him a couple of stretches to start working on. And I didn't have him just stretch his chest. I had him also stretch his shoulder, because they're very closely related. And a lot of times, if your pecs are really tight, then your shoulder's tight, or vice versa, and they can kind of lead into each other. But really, for him, he was just so thankful to learn that he did not have a tumor and that he was going to live. But just to help him problem solve, like, why this would have happened, I was asking him a few more questions, which I thought was rather telling. So the questions that I asked were, what do you do for chest day? And he was able to describe like 5 different chest exercises at different angles and different levels, and it was really intense. And I said, okay, so then what kind of back exercises do you do? And he's like, oh, I totally do back. I do lats at least once a week. And I'm only giggling out of lighthearted, I was poking fun of him or whatever. But the lats aren't the only back muscle that we have. There are a whole lot of upper back muscles that he was leaving out of his training routine. And what that caused for him was that his pec muscle was doing a whole lot of work in a very shortened range. As his shoulders are getting a little bit closer together than they should be, they're not held in that really good upright position anymore. And so when he's doing these really good chest days, he's just really contracting those pec muscles and essentially causing a muscle spasm. And that's why he was getting so sore. And so after a couple of weeks, he came back and said, I really did change up my workout program, and with the stretching and incorporating more back exercises, everything's a lot better. So thank you so much for those quick tips. And again, we poke fun at each other because we kind of work in the same place. But I figured that is probably something that really gets some people. Now, this other person not necessarily the best outcome, but just to show that you really do need to pay attention. He came in and he was just looking for a screening also, because he thought that he had hurt himself, but he wasn't quite sure. And of course, with insurance being the way that it is and trying to get into doctors, he really didn't want to have to go to the doctor if he didn't have to. And so he was really trying to avoid it at all cost. But he kind of knew something bad had happened. He had done a chest press and he felt a pop right at that moment. And that was his first clue. And the second clue that something bad had happened is that his whole pec muscle was completely swollen, and so swollen that you could actually see the fluid move if you touched his pec. And so I was like, you do not pass go, please. Please go to the doctor. You have to find out what is going on. You really do need to have somebody do an MRI and find out exactly what is going on in there, because something has been torn or severely injured for that amount of swelling in that area. That's just not a normal reaction to just being sore. And so unfortunately, that is what he had to do. He had to go and have surgery. So that was a little bit longer of a process for healing, but at least he didn't delay it even further by just not knowing and kind of waiting and seeing. So that is my overall thing, is that if you are having a problem with developing either chest strength, or you're just chronically having a lot of soreness at the end of those workouts, and it's a higher proportion to what it should be based on the workout that you're doing, or it's just not getting any better, then my suggestion is icing, stretching, and then trying to create a better back program and see if that helps you counterbalance those things. Of course, I'm here if you need a little bit of help figuring how all that would work, but I hope that helps. You have a great